The fourth behavioral emergency that we are going to discuss today are panic attacks. Panic attacks are sudden periods of intense fear that come on very suddenly and reach their peak within minutes. Panic attacks can occur unexpectedly or can be brought on by some sort of trigger, such as a feared object or a feared situation. Signs and symptoms of a panic attack generally heart palpitations, accelerated heart rate, tachycardic. Patients can be sweating. Generally, they're trembling or shaking. They feel that they are short of breath or that they are being smothered. The biggest thing that happens with this is that they have an impending sense of doom, an impending sense of death, like something horribly wrong is going to occur next. A large part of this is the feeling of being out of control. The biggest thing as providers, or pre-hospital providers rather, when dealing with panic attacks is that we initially want to try to verbally de-escalate these patients. We want to try and calm them via talking, having their mind think of something else other than the situation at hand, something that is of a calming presence to them. Largely, I know a big one that I use is breath work, box breathing. There's many different forms of breathing exercises that you can do, and they truly do help patients de-escalate. If this fails, you can also do an intramuscular medication administration of benzodiazepine, generally something like Versed, which we will cover in a little bit. Versed is a pretty fast-acting benzo. It's given in small doses, but it's very effective in helping patients calm down, relax, and give that sort of sedative effect that we are hoping for. Last but not least, we are going to cover excited delirium, everyone's favorite. Excited delirium is characterized by extreme agitation, combativeness, very bizarre behavior, and people who are in very high adrenaline states. Patients are generally known to exhibit unusual strength, extreme tolerance to pain, intolerance for clothing, noncompliance with anyone, especially law enforcement, who is generally on scene first, and hyperthermia. Obviously, the intolerance for clothing comes from this hypothermic effect. The exact underlying etiology of excited delirium is unknown. However, we do know that it is caused by an alteration in the dopamine levels in the brain. In most cases, patients are intoxicated on some sort of sympathomimetic or stimulant drug, be it methamphetamines or cocaine. Excited delirium is a true life-threatening emergency. These patients are at risk of developing severe metabolic acidosis, rhabdomyolysis, hyperthermia, and hyperkalemia. And all of these things can increase the risk of cardiac dysrhythmias and sudden cardiac death.